The following program is a paid presentation from the California Elder Law Center. The information and opinions expressed herein are solely those of the California Elder Law Center and are not the opinions of K-News, Alpha Media, management, or employees.
Hello, everybody, and welcome to Elder Answers. This is the show where we get together every week and we discuss the major issues facing seniors in the United States today. Hi, everybody. This is Michael McGuire, elder law attorney with the California Elder Law Center, where for over 25 years now, we have been helping seniors and the loved ones of seniors that are charged with the duty and the responsibility to take care of them throughout their entire lives so that they would be safe, they would be cared for, they would not be destroyed financially, trying to receive public benefits perhaps to take the sting out of the cost of long-term care. You know, there's more to it than just the money, though. There's a lot more to it than just being in a situation in which the care is paid for. There's the complete holistic approach to long-term care for a senior that requires you to do some planning. It requires you to think ahead. It requires for you, if you don't want to be a burden on your family, if you don't want to be a burden on your spouse, if you don't want to see your spouse go broke using up all the family money taking care of you, that you're going to be in a situation in which you're going to be able to be taken care of decently, ongoing, and a sensitivity to whatever it is the issues are that are really interrupting your daily flow of life. Now, what ends up happening here is that, most people tell us, and I think it's pretty consistent with what they want, is that they want to stay at home. I get that. Everybody would like to stay at home. But the tragic reality of that in the United States is 80%, that's 8 out of 10 of us, pass away in an institutional environment. And that many times is a direct result of the fact that we didn't put anything in place. We didn't do any planning. When should you do the planning? Well, you should be doing the planning when you're like 60. That's the ideal. Is that done very often? Not as often as it ought to be, let me tell you that. And as a direct result, we are faced with a crisis. And I don't know, maybe this year with everything that's going on in the pandemic and the anxiety is just raging through our society along with the actual COVID-19 itself, is that a lot of people are waiting, but they're waiting so late in the game, it's very difficult to get on top of the situation. And you end up having a lot of energy in the family, a lot of time and expense just trying to get on top of what could have been taken care of a year ago, 2 years ago, 3 years ago, very easily, so that everything was in place, so that the family, whoever the support is, the spouse to spouse, is all the paperwork is done, the authority is laid out. You can sail right through that aspect of the situation and focus on just the care. Now, when it comes to accessing public benefits, whether it's up to $10,000 a month worth of benefits from Medi-Cal, that's what it costs to be in a nursing home on average in California now, is $10,000. And when everybody's scrambling around trying to cope with that issue, if we had taken care of that a year ago, 2 years ago, 3 years ago, 5 years ago, then we don't have to suffer through the anxiety and the trauma of trying to get signatures for a person who's in a facility and locked down and you can't get in, can't find bank statements, don't know where the individual's Army discharge papers are, we don't know where the marriage certificate, all the things that add up to pandemonium that we could have taken care of a year ago, 2 years ago, 3 years ago. This past week, the situation in which the daughter is here from Phoenix. She's come over here. She's trying to take care of her father. He's living here. Her mother died in about better part of a year ago, and nobody's done anything with the paperwork, what little of it there is. And now we're confronted with a crisis. And now she's driving back and forth, trying to keep it together. But she has a family. She has kids. She has teenage kids who are in school. And actually, they're not going to be in school here very shortly because of everything that's going on with the pandemic. So her plate is pretty full. And yet she's trying to keep home and heart together for her father because he needs help now. And he's 5-hour drive away. And as a direct result, it's really taking its toll on her. And everybody says they don't want to be a burden on their family. I get that. That makes a lot of sense. But if you haven't done anything, then you are going to deliver a burden to your family, and it's going to be excruciatingly expensive while everybody figures out what's going on. And this is not, frankly, easy stuff. I mean, listen, the California Elder Law Center has been getting maybe on average $10 million a year worth of benefits, public benefits for our clients. We've been doing that year in and year out, accessing those kind of benefits. But this year is particularly difficult, and it's very emotional, and there's a lot going on that has nothing to do with the idea of how we're going to pay for the care. Everybody is sort of bouncing off the walls. And so the point is that if you are in a situation in which you do have documents, or if you don't have documents, now's a good time to think about coming in, sitting down, talking to an elder law attorney and finding out, should I be doing something to protect myself and my family and my spouse if we run into a problem? Now, this time of the year is a dangerous time of the year for seniors. This has traditionally been a period of time in which, for instance, the death rate among seniors spikes up. Why? Why is that? Well, there's certain basic common sense things going on. And of course, one of them is that, this time of the year, we're all subject to a lot of respiratory issues like the flu. Every year there seems to be a different brand. You have to get yourself vaccinated so you can protect yourself from the flu. And there has never been a year that getting vaccinated for the flu has been any more important than it is this year. This year. This is the classic case, get vaccinated. This is the classic case of get tested. And we're all waiting on pins and needles for the advent of a vaccine to deal with this COVID. Well, we don't have that vaccine, but we do have the vaccine for the flu. There's no reason for you not to get access to that and get that done now. This time of the year, we're indoors, it's cold, the weather's changing. There's a lot of rationales of why it becomes a situation in which particularly seniors are susceptible to respiratory illnesses that can really take a toll. I think there's a phenomena that actually the death rate goes up significantly when the amount of light every day shrinks. That circadian cycle of light can make a big difference in people's lives. And you will find, if you talk to nurses or doctors that work in hospitals, that typically during November, December, and January, as the death rate among seniors goes up. Well, do I need to tell you how exacerbated that is right now? And yet, there are things you can do, and you got to ask yourself, did you do it? Did you get vaccinated? To go over to the drugstore, get it figured out, take care of it. That's what this is all about. You have to take care of yourself. Nobody can do that for you. Some people don't like the idea of vaccinations or vaccines. Well, I would tell you something. I grew up in Pittsburgh, Pennsylvania, and we were the first kids in the United States to get the Salk vaccine to deal with polio. And I don't know anybody that didn't think a blessing had been visited upon their children that we were able to be vaccinated from polio. I think you had to live through that for everybody to understand how important that was to us as kids. The terror of polio and what it meant to you for the rest of your life if you contracted polio. And yet here was this miracle from Dr. Jonas Salk was being delivered to kids in our school right out of the gate. And as young as we were really happy to be getting that shot. And I will tell you, there's a certain amount of personal responsibility that goes along with this stuff. So I'm going to encourage each and every one of you to do the basics. What are the basics? Get a flu shot. Get tested. You can get tested just to make sure that you are not asymptomatic. The other thing that you can be doing is thinking about being conscientious. This is not a political statement. This has nothing to do with it. This is the science. This is where you should be at. This is where your head should be at, is you got to wear a mask. You've got to wear a mask. You've got to wash your hands. Lots of washing of your hands all day long intermittently. You have to be yourself being distanced from the person next to you. Make sure you stick to the 6-foot rule. And if you are somewhere, you should be very cognizant of which way the air is flowing. Now you think about this. If you're talking to somebody and the wind is at their back, then any aerosols coming from them talking to you are flowing because the airflow is flowing right from that person straight into your face. If you're cognizant of it, you can simply step to the side of the person, and so that you're both going to be in a situation in which you're safe. Not wearing a mask is not only to protect you, it's to protect the person you're with or near. You're going to have to deal with this reality whether we like it or not, no matter what our politics are. That's beside the point. That's beside the point. The science says wear a mask. The science says people will live that otherwise would not live if they are wearing a mask. We shouldn't have to plead with each other to do that, but it appears that that is the case. And if it's necessary to think the message through, then I'm saying to you, I'm pleading with you, wear a mask, wash your hands, socially distance, so that we can get through this and come out on the other side. And this has nothing to do with long-term care. This has nothing to do with that. This has everything to do with today. So I want to encourage you to participate in this process for your own benefit. Encourage your loved ones around you, and let's all get through this safely.
The cost of long-term care for yourself or a loved one can be financially devastating, but you can avoid going broke. That's how the California Elder Law Center will help you. You can access long-term care benefits through the VA, Medi-Cal, and other sources. But the process of getting those benefits can be daunting. That's where attorney Mick McGuire and the California Elder Law Center come to the rescue. Whether facing a hospital stay, currently in a rehab facility, an assisted living facility, or nursing home, immediate help is available. So now's the time to schedule an appointment for a free consultation. Our office is safe and virus-free. Call 760-422-0404. That's 760-422-0404. You'll learn so much about how to resolve your elder issues. It goes beyond paying for long-term care. With the help of an attorney at the California Elder Law Center, you can avoid the expense and delays of probate. You can protect your home, your family, and your assets. The system is complicated and frankly not user-friendly. But when you work with an attorney specializing in elder law, it's all so much easier. Call 760-422-0404 for a free meeting in our safe, virus-free office. That's 760-422-0404. Online, search Cal Elder Law. That's Cal Elder Law, helping you get the care you need and deserve. The California Elder Law Center.
This is Michael McGuire with the California Elder Law Center, elder law attorney, coming to you every week here on Elder Answers. You know, there's a real issue that all of us face. All seniors face this issue, and I think it's something that's really, really scary. I know a lot of people are really, really concerned over the issue of dealing with dementia. You know, I do not feel that the United States has a very good system or process to assist seniors that are suffering from Alzheimer's disease or dementia. There's nothing in place. There's nowhere to take care of them, these people. And as a result, the medical system is giving everybody sort of the bum's rush to get rid of these types of patients because they don't know what to do with them. And it can be a long, protracted process. The average for a person who's diagnosed with Alzheimer's in the United States is from date of diagnosis to date of death is anywhere from 5 to 20 years. But there's another phenomenon that takes place, and I think now more than ever before, and that's, are we really talking about, and is there a way to distinguish between somebody is feeling depressed and is suffering from depression as opposed to dementia? You know, there's a sort of bias in the medical system against women. For some reason, the medical system seems to think that the women tend to be hypochondriacs and they complain more, even though the reality is they're being more conscientious about their health care, to tell you the truth, than men are. And as a direct result, they're more likely and willing to go to a physician to be treated or to at least be diagnosed. And that gets sort of pushed aside, and there's still a bias in the system against women. But right now, what's going on, and it's pretty obvious because I'm seeing it, is that there's a lot of people that are, frightened about the idea that they may be dealing with dementia, but they are definitely dealing with depression. Now, it's not just seniors that are depressed right now. The entire world is suffering from depression right now because we are in what we thought was by now would be over, but it turns out we're really heading into another more vicious phase than any phase that's even preceded us with regards to the pandemic. It's bad, it's getting worse, and the numbers are bigger. Well, that makes sense when you think about it. It's been here for 10, 11 months. There are more people who have contracted the virus. That means there's more people to spread it to even more people. So yes, we are going to have more cases, and that means more people are going to be in real harm's way. And that means that we live with this kind of angst in our lives now more than ever before. But you really, you want to find out, am I suffering, or do I feel depressed, or is this dementia? And if your kids are here in town for the holidays, this is usually when we start getting a lot of phone calls from the adult children. Is, I need to get some stuff done for my mother. I need some stuff done for my father. I need to make sure the paperwork for my mother and father is right and is ready to go in case we have an emergency. And really what you're talking about is that, can everybody sit down and say, well, I'm going to go see a psychiatrist or a neurologist and everything? Because depression can somewhat mimic dementia. But depression, you should not accept this idea of being diagnosed with or self-diagnose. Depression is not a normal part of aging, okay? Older adults have an increased risk for depression. One reason that depression is more common in people who have other illnesses. And 80% of older adults all have at least one chronic health condition. That chronic health condition is something that, like diabetes or high blood pressure or macrodegeneration, that is going to hang on for a long time. And the majority of older adults today are not depressed, and diagnosing it can be complex. But many older adults underreport their symptoms. They just don't really face up to it, to tell you the truth, and they don't necessarily describe themselves as depressed. A keen clinical interviewer, that's somebody, a doctor or a psychologist that can really spot these kinds of things, will ask about the certain items in your life that are bothering you. Are you having feelings of loneliness? That you're trapped in your situation? That you're it's a hopelessness, fears of being burdensome on your children? That there's this overhanging black cloud that is keeping you from being free of these nagging thoughts that come to you. And this process can be very debilitating for a senior. And if you couple that with a diminished level of capacity, it's hard for me to get out, I'm not really walking the dog anymore, the exercise is too much for me, I've become very sedentary. You don't want to accept that. You don't want to live like that. But that takes real willpower, or it takes the support of your family to help you get through that process. I have always been a big believer that you have to cope with anxiety in your life. You have to look it right in the eye, and you have to make the decision about, are you going to live and let anxiety control you? And that can cause you to be depressed. That can cause you to be worried about something that hasn't happened. But if you have to acknowledge and recognize that our brains are connected to our bodies. There's a connection there. If you're depressed in the amount of activity that you're pulling back from life, you're not participating, you're not getting out there, yes, it's going to have an effect on you. And this time of the year, if you have the kids, I get phone calls, oh, I heard your radio show when I was driving back into town or coming into town, talk to my mother, my father, visit, and they start to recognize there's a change. Now, you, spouse to spouse, may see there's a change. You, as a friend, a dear friend, may see a change. And that person is in somewhat of a downward spiral, and so they're going to have to acknowledge it and deal with it. So how can you tell if you're starting to begin suffering from dementia versus depression? What are we dealing with here? Because they can mimic each other so much. In order to get the most accurate diagnosis, you need to talk with a professional. But there are there's really some telltale signs that often set the two apart. In the case of depression, problems with concentration and focus often develop over weeks. There's no doubt about that. With dementia, problems with cognition develop gradually, and concentration is usually normal in the early stage. In depression, the individual is often aware and concerned about their cognitive deficits. In other words, if you're depressed, you start to really, you know what's going on. Dementia patients, however, will often show much less concern for their cognitive problems, and they minimize their deficits. They really fool themselves, in other words. For a depressed patient, loss of interest and desire to isolate usually happens quickly, and you may even be able to pinpoint a specific trigger. With a dementia patient, loss of interest or activity happens slowly, often taking years to fully come to fruition. Recognizing depression may be at play can prevent costly workups for dementia, and more importantly, can spare the family and the patient emotional distress of a premature label of dementia. Once that label is tagged on you, you lose a lot of ground in society. You want to make sure that you or whoever's taking care of you gets that one right. Dementia and depression can exist together, with patients meeting the criteria for depression with early stage dementia or a mild cognitive impairment. It is imperative to identify and treat the depression in these individuals. Research shows that doing so can improve their quality of life and slow the dementia process. Treating their depression early enough could potentially stymie the dementia process altogether. The important thing to know is that depression at any age, in any stage, deserves treatment. Living a meaningful life does not have an age limit. Look, we've all known people in our lives that have suffered from the ravages of dementia or depression. But getting those two mixed up is not going to have the kind of an outcome you need or deserve. Your family wants to know if they're approaching this properly. You need to get up off that couch, out of that easy chair, make an appointment, and go in and see a professional. You know if you're suffering from this. You know if you've lost interest. You know if you're having memory problems. You know those things. Now, if you start having an issue, you can't remember where you put your car keys, that's not dementia. That's not what we're talking about. If you're feeling down because you're feeling stressed and anxiety because of the pandemic we're in, that's not depression. But if you have these lingering fears and senses of loneliness and isolation, if you're feeling down and blue and you can't get up, your physical activity is your contact with other people. You're not so quick to pick up the phone and call somebody or even answer a phone call when you get a message. You may be entering into that phase. Is it worth it to you? Is it worth it to you to find out? Well, I will tell you something. If you're diagnosed with dementia, you are probably going to lose a lot of control of your life. That is something you do not want to have happen if that's not what's going on. Now, if you are an individual who feels that dementia is becoming a issue in your life, then you need to make sure the safety net that's around you through documents, an advanced healthcare directive, a durable power of attorney, a trust, those have all been put in place and they're done. Your kids need the authority to take care of you. Your loved ones, your spouse needs that authority. But if it's depression, that's something that you can pull up on the stick and pull out of, and then that's something that you want to do. You want to get treated and you want to recognize it, and you don't want to surrender to it.
The cost of long-term care for yourself or a loved one can be financially devastating, but you can avoid going broke. That's how the California Elder Law Center will help you. You can access long-term care benefits through the VA, Medi-Cal, and other sources. But the process of getting those benefits can be daunting. That's where attorney Mick McGuire and the California Elder Law Center come to the rescue. Whether facing a hospital stay, currently in a rehab facility, an assisted living facility, or nursing home, immediate help is available. So now's the time to schedule an appointment for a free consultation. Our office is safe and virus-free. Call 760-422-0404. That's 760-422-0404. You'll learn so much about how to resolve your elder issues. It goes beyond paying for long-term care. With the help of an attorney at the California Elder Law Center, you can avoid the expense and delays of probate. You can protect your home, your family, and your assets. The system is complicated and frankly not user-friendly. But when you work with an attorney specializing in elder law, it's all so much easier. Call 760-422-0404 for a free meeting in our safe, virus-free office. That's 760-422-0404. Online, search Cal Elder Law. That's Cal Elder Law, helping you get the care you need and deserve. The California Elder Law Center.
This is Michael McGuire with the California Elder Law Center. And you're listening to Elder Answers. This is a show where we get together. We try to give you information that you can use to protect yourself, information that you can use to be prepared for what's up ahead in your life, information that allows one spouse to take care of the other spouse, information that you can put together some kind of a safety net around yourself, and you create that usually through documents that include things like a living trust, things that may be like a durable power of attorney, an advanced healthcare directive, a will, all the things that are necessary to prudently protect yourself and your loved ones, and to allow you to experience these years of your life without being a burden on your family or without going broke. You know, if you get this done by an elder law attorney, you're in great shape to be able to access benefit through Medi-Cal here in California that'll pay for your stay in a nursing home. Now, the average cost of being in a nursing home in California currently is $10,298 per month. 1 month. And man, does that first of the month roll around again fast. So if you feel that you have been a taxpayer all your life, if you feel there's a benefit there that could be of help to you, you don't know, you don't need it today, but you want to know that if the time comes, you or your loved ones are going to be in a position to be able to get you that benefit, then you have to take some action. You have to pick up the phone and call 422-0404. 760-422-0404. And when you do that, you're in a position then to arrange for a consultation to see a couple of different things. I don't have any documents. Now I know I should do something. Well, then you definitely have to step up to the plate and make sure you create a safety net around yourself. I have documents, but they're old. Maybe 5 years old, maybe 10 years old. We just sort of put them in the closet and forgot about them. They probably are not going to be effective in the world that exists today. What you can do is have those documents reviewed, have them analyzed, and if there's a recommendation, you will get the recommendation free of charge, so you'll know that what you need to do to make sure that you or your family are protected. If you're the adult child of a senior right now who's having troubles, or you're a little bit worried about what's up ahead, you need to act now. If you wait, it may be too late. It's as simple as that. 422-0404. Or you can go on the website, www.cal-elder, ELDER-law, calelderlaw.com. Lots of great information on there. You see, once you get sucked into this system, it's always been tough. The system is unrelenting. The system wants to sort of propagate itself. It wants to protect its profitability. It does not want to get stuck with any liability if it can figure out a way to shed that liability. So none of that adds up to a good deal for you. Now, today, with the pandemic, it's much worse. We have cases where people have gone into a hospital and have been shipped out in the middle of the night because they're Alzheimer's patients. And as a direct result, they didn't have any ability to control or protect themselves, and the facility shipped the person out to a psychiatric hospital over in Riverside. They shipped a lady all the way to Glendora. Can you believe that? They went to Glendora and dumped this woman. And then they bounced her back and forth between a couple of facilities, and they were getting ready to move her out to a nursing home out in Banning, as it turned out. And then she died. But during that cycle of real mistreatment, what was going on was that her family was not being told where she was. We have a situation in which an individual family had the father was in the hospital. He was a COVID patient. He was in bad shape. They were discussing among each other, the family, that day, starting in the morning, about putting him on hospice because he was at the end of his life. And they wanted to talk to all the children in the family about the decision. About 6 o'clock that afternoon, early evening, they got a phone call from the hospital. It wasn't from the hospital. It wasn't from the doctor. It was from an employee in the morgue. They wanted to know, what should we do with the body? That was the first time the family was told that man had died. She asked them, when did he die? They said 11 o'clock this morning, and they called at 6 o'clock in the evening from the morgue. You know, you don't have to tolerate stuff like that, but you have to be active, and you have to set something up in the way of documentation, and you have to be made aware. What should I be saying? What should I be doing when I'm in the hospital? When they send me to the rehab, which one? Do I get to control that, or do they have to control that? And so once you know what the rules are, and or you have created a documentation package that allows you to delegate these kinds of decisions and activities for your benefit, then you can rest easy. Now you're getting closer to getting the kind of an outcome that you want, the care that you need and deserve, and the ability to access benefits so you don't go broke doing it. Now you have to recognize the system is stressed. The system is stressed, and that's why you want to come in. Bring in your documents if you have old documents. Some of these documents have been, they went to the non-attorney cheapo routine, and when you actually take a look at it, when you see the documents, you realize what a dreadful decision that was. Classic here was not so long ago. There was a gentleman. He had no children, but he did have he had a brother and his sister, siblings. He had a fairly sizable estate. Everything was going to be left to his brother and his sister. Now, there were a grand total of 8 nieces and nephews. In the event that one of the brother or the sister had passed away first, then he was laying out a plan about how the money would go to the nieces and to the nephews. When they did the documents over at Cheapo R Us kind of a place, the drive-through estate planning place, here's what ended up happening. They reversed everything. They gave all the money to the 8 nieces and nephews, and if any of them and all of them had died, then and only then to his brother and his sister. A complete reversal of the way it was supposed to be. It was a typo. Somebody didn't know what they were doing. Those kinds of stories are legion. Coming into an estate planning attorney's office and trying to fix something that went badly awry. There's a reason that you get this stuff done right, and that you're conscientiously getting it done, because it can have dreadful impact down the road during and right in the middle of a crisis. That's usually the problem. We're in a crisis. Now, elder law, on the other hand, is not only trying to satisfy your need to be protected as far as your estate is concerned, that when I've died, what happens to my money? Where does it go? Avoiding probate, all those kind of issues, protecting maybe somebody with a special needs. That's estate planning. What happens when I die? Elder law is focused on answering a different question. What happens if I live? What happens if I live? Who's going to take care of me? How am I going to pay the bills? How am I going to come up with $10,000 a month if that's what fate has dealt me? That I have to be in a skilled nursing facility around the clock. And I will tell you, it's an ongoing battle. It's an ongoing battle, and the reason for it is money. It's money. These facilities now and the entire system is driven by money. Now, there's nothing wrong with everybody making a profit, whether it's the insurance company or it's the hospitals or the skilled nursing facilities that are owned by corporate entities. Of course, they have a right to make a profit. Of course, that's got to be part and parcel of their charter. They have stockholders to answer to. Everybody gets that. But when you have a situation in which everybody is trying to disingenuously steer you in the wrong direction in order to enhance their profitability, we got a real problem on our hands here, Houston. And that's what we have in this country right now. So how do you resolve that? How do you do that? You need to get and sit down with somebody who's an expert in this field, somebody that's done it for, 25 years. You pick up the phone, you call 422-0404, and I want to come in. I want to sit down. I want to talk to you. Now, if you are coming in, if you're doing that, then of course what you want to be doing is safe. I want to be safe. I want to know that you've taken precautions, that you have an air filter in the room, that everybody's wearing a mask, that there's an acrylic shield between myself, that I can go through this stuff safely, that everything has been disinfected before I go in, and everything will be disinfected when I leave. Or if it's necessary, if you have kids that are like in Orange County, or if they're up in Seattle, or if they're in Texas, or they're back on the East Coast, that's what Zoom is for. You can have your meeting and your kids can be sitting right there too. That's the idea. And so we have to figure out a new way of approaching these kinds of things. And the number one situation for you is that, listen, let's get real here. I'm 80 years old. I don't have any long-term care insurance, and I have absolutely no hope of ever getting any. So how am I going to pay? Well, it's not my problem today. I'll do it tomorrow. I'll think about it. Well, you know how that turns out. You all know how that turns out. You can't live your life like that. You never did. You wouldn't have had a home. You wouldn't have gotten an education. You wouldn't have had children, gone to college. You wouldn't have done any of those things if you waited till it was too late, or you were knee deep in debt trying to figure it all out. That's not how that works. 422-0404. 422-04. For what purpose? I want information. If I get information, then the anxiety I'm feeling about not having this issue taken care of or addressed will start to shrink and go away. Once that starts to happen, my head clears. I can make good quality decisions for myself.
The cost of long-term care for yourself or a loved one can be financially devastating, but you can avoid going broke. That's how the California Elder Law Center will help you. You can access long-term care benefits through the VA, Medi-Cal, and other sources. But the process of getting those benefits can be daunting. That's where attorney Mick McGuire and the California Elder Law Center come to the rescue. Whether facing a hospital stay, currently in a rehab facility, an assisted living facility, or nursing home, immediate help is available. So now's the time to schedule an appointment for a free consultation. Our office is safe and virus-free. Call 760-422-0404. That's 760-422-0404. You'll learn so much about how to resolve your elder issues. It goes beyond paying for long-term care. With the help of an attorney at the California Elder Law Center, you can avoid the expense and delays of probate. You can protect your home, your family, and your assets. The system is complicated and frankly not user-friendly. But when you work with an attorney specializing in elder law, it's all so much easier. Call 760-422-0404 for a free meeting in our safe, virus-free office. That's 760-422-0404. Online, search Cal Elder Law. That's Cal Elder Law. Helping you get the care you need and deserve. The California Elder Law Center.
So this is Michael McGuire with the California Elder Law Center, and you're listening to Elder Answers. Covering a lot of ground today. Don't get confused between depression and dementia. If you're not sure, you're worried about things taking over your life, go see somebody. You're on Medicare. You have access to somebody, a professional. Don't be bashful about doing it. Don't think you're a tough guy and you're going to work your way out of it. It doesn't work like that. And so when you do these kinds of things, when you take care of yourself, then you need to think about taking care of your family, don't you? Because why? Well, you don't want to end up being a burden on your kids, on your family, on your neighbors, on your friends. Take a little bit of time. 760-422-0404. Get some answers. Get some information. It's free. It's free. You should have an advanced health care directive. Who's going to make medical decisions for you when you can't? And have you decided how you want the end of your life to go? Do you want to not have heroic measures? Do you not want to be hooked up to machines and tubes? Do you want to be made peacefully, allowed to pass away peacefully? Do you want to have pain management administered to you? Do you want all that kind of stuff? Well, then you need to do that. You need to say it in writing. You need to give that authority to somebody. If you run into a period of time in which you can't really handle writing checks for the bills, you can't really pay for stuff, you need to have somebody being very careful about how your money is being handled and treated, somebody you trust and somebody that you can count on, then you have to say that in writing ahead of time. They don't have any way of getting into those accounts and taking care of you without that. They can't sign checks. They can't get involved in any of that. Do you have a piece of real estate? Do you have assets over $120,000? Then you should be thinking about a trust. Because otherwise, your family is going to get dragged through the probate court. It's going to cost them thousands and thousands and thousands of dollars, and it's going to take them a year and a half, 2 years, needless time and money and expense simply because you didn't take care of business. What's the answer to these things? Well, the answer is to do some estate planning. Now, when you do estate planning with an elder law attorney, you pass from one issue of answering the question of what happens when I die, where does my stuff go, into a different answer to a different question, which is, who's going to take care of me? What happens if I live? You know, if you're a woman in the United States today, age 80, you have a life expectancy of another 10 years overnight to end up being 90 years old. If you are a man, you have a life expectancy at age 80 of being 88 years of age. Well, I got news for you. As you move through that process, as you age, you become less and less interested in some of these issues, more and more interested in your comfort and your safety and your care. How do we do that? Are you a veteran? Or were you married to a veteran? You can get $26,000 a year tax-free under a certain set of circumstances to defray the cost of having somebody come into your home or to go into a beautiful assisted living facility or a lovely board and care or maybe you'll need a memory care unit. Money that comes to wartime veterans simply because they served this country and were in harm's way. Now, they did not have to be in combat. They did not have to be in theater. They had to be in uniform. But you need to get that information, and you need to get it ahead of time. You need to get it ahead of time. You know, we had a lady that she fell down. How did she fall down? Well, she was developing dementia. She wandered away from her home in the morning in her nightgown, and she was gone for 4.5 hours. They couldn't find her. She tripped, fell into a ditch, literally into a ditch, and they could not find her. The sheriffs looking for her drove past her several times because they didn't know she was in the ditch. Finally, they discovered her, and the reality was, when they discovered her, that she had shattered her shoulder. She had broken her shoulder in 5 different places. They took her to the hospital. They gave her Tylenol, and the next day they wanted to send her home. It was too dangerous to do any surgery to fix that shoulder, just put her in a sling. Well, hell, who's going to take care of her? I mean, how is she going to get bathed? How is she going to eat? Who's going to give her the meds? Who's going to look after this person? Should she be at home? Should she not be cared for in the hospital? Should she maybe not be sent over to a rehab unit so she can develop the skills perhaps to regain use of her shoulder, her arm? Well, of course she should, but that's not how the system works. You need to be cognizant that if you want to be taken care of, well, you're responsible for that, not them. You pick up that phone, you call 422-0404. 422-0404. So many of you are coming into the office, you've got these documents that were done 5, 10, 15 years ago, and you're really worried that they don't work in this world anymore, and you're correct, they don't. Not for the purposes that we're talking about anyway. So what is it that I do want? What do I want? I want to know that if I have public benefits coming to me, I'll be able to access those benefits, and I have to assume that I won't be the one doing it. I have to know if I have a daughter, if I have a son, if I have a couple of kids, if I don't have any, how is that going to play out? Who's going to do this for me? If I'm here by myself, I don't have kids. Is there any way that I can have a person take care of me, to keep an eye on me? And the answer to that is yes. Yes. We can get to geriatric care management. We can get a nurse practitioner. Oh, how much does that cost? Well, is that really the concern? That's a question that has to be answered somewhere along the line, but that's not until you understand what it is you're talking about. Once you understand and get information, the anxiety will fly away from you, and now your head will clear, and you can make a conscientious decision about what's in your best interest. Do you think this works really good if you're already in the hospital, in the ER? And I'm going to tell you something. Hospitals today are just about tapped out. With the pandemic, they are just about tapped out. And so you need to have your kids or somebody there for you. If your kids live 5 hours away, or if they live 3,000 miles away, you're going to have to figure that out. You can't do any of that until you get the information. And here's the good news. The really good news is there are viable solutions to these problems. What you have to do is sit down and analyze the facts as they exist for you today with an expert that's been doing this kind of stuff. And then to have some resources available to you, to have your children be informed to support you, to be able to take care of each other so that when the time comes, you know where to call, what to do, what's next. You're not going to turn yourself into a long-term care expert, believe me. That's not how this is going to work. What is going to work is you're going to make a conscientious effort to come up with a plan that will protect you, your spouse, not be a burden on your children, and make sure that you don't go broke. that there'll be money there for you. And so you need to pick up the phone and call 422-0404. We'll sit down with you. We'll go through this information and give you all the information, not some of it, all the information, so that you can make a good quality decision both for yourself and your family. You know, just having a place to go and to get a straight answer to what should be an obviously easily answered question is really, really comforting. Knowing that if something goes wrong, you can say, call that office. They have my paperwork and they know what to do next. Just knowing that there's something in place that when fate has you in harm's way, that you will be protected and taken care of. We have no idea when we're going to have a stroke. We have no idea when we're going to trip over the cat and fall down and break our hip. We don't know if we're having dementia or cognitive issues because those people typically do not know that they're in that mode. That's one of the heartbreaks of that kind of a disease. And so just knowing that you have done everything reasonable, everything that's prudent, so that the outcome for you is going to be safe care. To the extent possible, it's going to be care that is not going to destroy you financially, that alternatives are there to support both you and your family to deal with the issues of aging for you, especially if you are in crisis. Crisis is something has happened, you've been whisked off to the hospital, and now what? Now what's going to happen? Over and over again, people today are facing these kinds of issues, and they're all lamenting that they didn't take care of it sooner. Who's doing the lamenting? It's their families that are now experiencing the burden of trying to figure all this out. It's the spouse who thought this was all taken care of or just never got really interested in it, and they just let it drift along, and now, guess what? We're in over our head. And you don't have to do it that way. You don't have to accept that. And you have to remember that anxiety means that you're concerned about something that hasn't happened yet. Regret is you're living in the past. Anxiety is you're living in the future. You need to be in today. That's why you pick up the phone. You call 422-0404. You arrange for a face-to-face consultation. You arrange for a Zoom meeting so that we can help you, get you information, and set you on the right path. If you choose us, terrific. If not, you've got the information. It was free. This is Michael McGuire with the California Elder Law Center, thanking you for making Elder Answers the successful #1 senior radio show in the Coachella Valley. And looking forward to talking to you again next week.
A child struggling to speak. It's often a developmental disability that can leave a child frustrated and isolated. Life-changing treatment by professional speech therapists is available at no cost to the family. It's at the Stan and Bobby Gold Right Care Childhood Language Center in Palm Desert. We need your donation. On your phone or computer, search Gold Right Care. That's Gold, R-I-T-E, Care. From the Palm Springs Scottish Rite of Freemasonry. Give a child the gift of speech.